As you all know, the International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and homeopathic doctors. And we have 3 sessions every day. The first session is already over by now. That's our Hindi session, which began at 7:30 to and end up with 8:30. And then our English session from international level goes to from 8:30 to 9:30. And we have a local language session in Malayalam from 8:30, 9:30 to 10:30. Every day, all these sessions are going in a good way, and we are uploading the videos on the very next day itself, so that those who missed the watch the first part or second part of any of this session can watch it again and again, and you can subscribe it by searching IFPH Homeopathy. So let me come to the today's session. As you all know, we have a wonderful guest in Professor Dr. Dharmendra Sharma, who has completed MD Home and PhD Homeopathy and PGDMLS, and is the principal and professor, head of the Department of Forensic Medicine and Toxicology, and Dean and Faculty of Homeopathy, TPU, Pimpri, Pune, Maharashtra. Is a member of the planning and monitoring board of DPU Pimpri Pune, and member of the board of research, chairman research and recognition committee, member ethics committee, BDJT Homeopathic Medical College, Dharwad, Karnataka, and a member board of studies, Bharatiya Vidyapith Pune. Sir has presented some sessions earlier, and all the presentations were brilliant. And today, Dr. will be discussing about the innovative teaching learning methods in medical education. That's a very good subject to watch. And let us invite the guest of the day, Dr. Dharmendra Sharma. We proudly welcome you, sir.
Thank you, sir. Danish, sir. Can you hear me?
Yes, everything fine, sir.
Thank you very much, Dr. Danish, sir, for the introduction, and Sahani, sir, for having me on this platform. My PPT is already with them, so I think somebody needs to
Yes,
get
sir.
it rolling.
We can share it.
Yeah.
Shall I start sharing?
Yes, sir.
Yes, sir. Please.
Yes, sir.
Please carry on, sir.
Okay, sir. Can it get into the slide mode?
Yes, sir. I shall try for some time. You may begin the session. In between, I shall make.
Okay. So our topic for today is teaching learning methods and media, and it's very important for every doctor because the basic. Can you hear me, sir?
Yes.
Okay.
Yes,
Basically,
sir. Yes,
because
sir. I
it's
can hear you.
okay, sir. It's very important for all of us because we every day now and then we call ourselves doctors actually, and many of us actually do not know the derivation of this word doctor. So the word doctor itself is derived from the Latin word docere, which means to teach. So whom are we going to teach? So we are going to teach our patients. What are we going to teach them? So we are going to teach them matters pertaining to health. So a person who reads from the books of nature and teaches is a doctor. So that is the derivation of the word doctor. So that is why it's very important for a doctor to teach patients, and a doctor cannot teach without actually learning. So that means a doctor, once you become a doctor, you become a teacher and you become a learner also for your whole life. So whenever we choose this profession of medicine, we are in for teaching and learning, which is never going to end for all of us. And this seminar, which IHPF is continuing, this continued medical education, this also it takes root from the fact that we all are doctors, and that is why our teaching and learning never stops. So hats off to Dr. Danesh and Dr. Sahani and all the people who are running this program, and so many lectures and so much more we get to learn every day. So this is the basic word of the word, the meaning of the word doctor, and that is why today our topic is teaching learning and the method of teaching and learning. So if you see that the importance of effective teaching methods and media is facilitating in student learning, also we are going to see to explore the various teaching methods and media and to understand their effectiveness. Also, we will be learning how to integrate them into instructional practices. Can we move ahead, Danish sir?
Please.
Okay, so often we try to discuss what is this learning about. So learning is nothing but transformation of information into knowledge. So transforming any information which is available in the world into knowledge is what learning is all about. And we also modify the learner's way of thinking, feeling, and doing. So it also modifies the learner's way of thinking, feeling, and doing. So, in short, if you see, learning is the acquisition of the knowledge, skills, attitudes, and behaviors through the study, through experience, or through teaching. So, learning is nothing but the acquisition of knowledge, skills, attitudes, or behavior through study, experience, and teaching. So, this is about learning. Now, we come to what is actually teaching about. Sir, are we getting the slides? Sir, can you see the slide?
Everything fine, sir. You can go ahead.
We can,
Learning,
okay,
there's
okay.
second.
Okay, so I'll come to where I was stuck. I was stuck at what is learning. So
Okay.
learning is transformation of information into knowledge and modification of the learner's way of thinking, feeling, and doing, which means that learning is actually the acquisition of knowledge, skills, attitudes, and behaviors through study, experience, and through teaching. Then we come next to what is teaching actually. So it is a process which facilitates the learning by encouraging all the learners to think, to feel, and to do. Then we come to the purpose of the teaching and learning procedures. So why do we actually teach and why do we actually want to learn? So number one is to develop the learner's intellectual skills. So if there are students in the class, we want to develop their intellectual skills. Secondly is to comprehend the, my video is off. Yes. So the purpose of teaching learning procedures is to develop the learner's intellectual skills, to comprehend the principles and generalizations, to analyze ideas or any issues critically, to also develop the learner's psychomotor skills, and to develop values among learners. Many times the teaching learning also teaches us value system. We know that as doctors, we are the only people in the world who have some ethics to follow. So what are these ethics? These ethics are nothing but the moral values. Like when we were small children, our grandparents used to tell us stories about the Ramayana and the Mahabharata. And in Ramayana they used to try to teach us through a story like the Ramayana, who is the ideal son, who is the ideal father, who is the ideal wife, the ideal friend. So these were the value system which got into all of us. And that is why doctors are supposed to have ethics and to have values. So this is one of the purpose of the teaching learning procedure. So why should we have different teaching and learning methods? Why is it not easy for us to have only one method to teach the students? Because number one is that different students learn in different ways. When we were students in college, we all knew that students want to learn in a different learn in different ways. So different types of students have different methods of learning. Some people repeat, read aloud. Some people just write and then learn. So there are different methods of students learn. Then there are different objectives in a class. There is only not only one objective, so there are different objectives. So these objectives also need to be taught in different ways, and also that different settings are required for for different methods of teaching. So coming to what strategies we can have for teaching and learning. So number one is transmitting lectures, uh, transmitting. Then second is instructing, third is coaching, and fourth is to facilitate. So how do you transmit a lecture? So it is by a lecture. You can transmit knowledge. You can transmit knowledge through reading materials, to memory devices. Then you have instruction by mini lectures, by active learning, by collaborative team methods, and you have coaching which can be facilitated through mentorship, demos, role plays, and to facilitate by problem based learning or project based learning. Then now we need to classify the teaching and learning method. So how do we classify teaching and learning? So it is based upon number one, the size of the class, the teacher learner control method, and the different domains of learning. You had different methods of domains of learning, like you have the cognitive, you have the psychomotor. So for all these methods you will have different this will be the base upon which you will decide which teaching and learning method you need to use. You cannot have a lecture for everything. For example, you want to teach somebody about how to take a blood pressure, it cannot be taught in the lecture classroom, so it needs to have a different method to teach them. Then based on the size of the class, you can have a large group where you have 100 students in the class. You can have small group teaching, and you can have individualized teaching like you have in a mentorship. So if you come that now we want to teach a large group, so what are we going to think about when there are more than 50 or more than 100 students? So you can think of these following things which is visible on your screen. For example, you can think of lectures, you can think of organizing a symposium, you can organize a flipped classroom. We'll come to what is flipped classroom later on. And you can organize a film or a video presentation for a large group. You can have a panel discussion, and you can also have a jigsaw method of teaching. We'll be coming to that later on. Now, when you want to teach a small group, what can you do? So you can have a group discussion, you can have a demonstration, you can have a practical bedside teaching, role plays, tutorials, seminars, project works, and simulation techniques. These are methods in which you can teach small groups. Suppose you want to do an individualized teaching. In that, you can have a direct, you can tell the students directly to read from the text. You can organize a problem-based learning class where students are given a problem and they are told to prepare it, to discuss it, prepare it, come over here together, sit together and discuss it, where you can just be the guide to them. Then you can tell them to just read directly. You can give them some project work, you can give them some simulations, like we have the role plays. We do normally role plays in materia medica, so you can act out a particular drug, for example calcarea carb or sulfur. What is the constitution, what does the patient say? These are simulative methods of teaching. And you can also have a method which is called as counseling. So we'll come one by one, we'll discuss all these things. So we'll come to the first thing, which is called the lecture. Lecture is a careful presentation of the facts with organized thoughts and ideas by a qualified person. So anybody cannot take a lecture. To take a lecture, you have to actually be qualified. And to teach in a homeopathic college, earlier the qualifications which was prescribed in the minimum education standard were different. And now it is that you need to be minimum MD to become a teacher in the college. So that's how you need a qualified person to take lectures in the class. So what is the advantage of a lecture? Number one, it is very economical because you have so many students. One teacher can teach 100 students. It covers the whole topic. One lecture can cover the whole topic. Then it is easy to plan in a time schedule, and very large material can be imparted in that short period of time. So if the lecture is 1 hour, students usually don't focus for 1 hour. So 40-45 minutes lecture is good enough, where the attention span of the student is there. The disadvantages are that usually it is the teacher who goes on teaching, and the students, many of the students are in a different world. They sleep in the classroom also. So it is a passive way of learning. It is more teacher centric because the teacher is everything focused around what the teacher wants to teach. So now you have the new competency based dynamic curriculum, which is which is a turnaround from what the teaching method used to be in the past. And now this new CBDC technique is more student centric. So rather than being teacher centric, now it is student centric. And that is why the whole format, the NCH has done away with the old method of teaching, and we have this new method of competency based curriculum. Then it does not cater to the learner needs. These are some of the disadvantages of lectures. So what are the guidelines to be an effective lecturer and to be conduct an effective lecture? What do you know? Number one, you need to plan your presentation. Without planning, you cannot conduct a good lecture. Then all your material which is there in your lecture has to be arranged sequentially. So sequentially arrangement of the material, it should start with the introduction. You just cannot start with the conclusion first. So you need to start with the introduction, then the material, and then after that you need to conclude the lecture. So this arrangement of the material in sequence is very, very important. Then the teacher faces the student most of the time, means rather he needs to face the student all the time. He cannot show his back to the students. Good illumination is necessary. You cannot have a dark classroom. That is why one of the basic criteria is that a well lit classroom is very, very important. There should be a lot of clarity in the speech. If there is no clarity in the speech, students will not follow what the teacher is saying. And the teacher also needs to emphasize the key points when he's taking a lecture. All the key important points should be repeated so that it sinks into the skull of the student. Then at the end of the lecture, he needs to summarize the whole lecture, because what happens is that it's like a jigsaw puzzle. It's all scattered in the mind of the student, and the summary, when the teacher summarizes at the end of the lecture, all the bits and pieces fall in place. And then finally he should also take feedback from the students, so that if students need something else, so the teacher should be able to deliver that in his next lecture. So that was about a lecture. We'll come to the next thing, which is a symposium. We often use these words commonly. What is a symposium? What is a seminar? But let's discuss what a symposium actually is. So symposium is a series of talks by experts on many aspects of the topic under a chairperson. For example, if we have a symposium on hepatitis, then there can be a person who can discuss the pathological aspect. There can be a person expert who can discuss the symptoms and signs of hepatitis. There can be a person who can discuss the differential diagnosis, and there can be a specialist who can discuss the pharmacological aspect of it. So that is what a symposium is all about. So it's a series of talks by experts on many aspects of the topics under a chairperson. So a chairperson is there who will be guiding the symposium in the right direction. The advantage are that short speeches, and that because the speakers keep changing according to their specialty, it maintains the interest, so the students don't get bored for that. So that is the advantage of a symposium. And the presentation is very concise and very, very precise. The disadvantages are, again, the audience is passive, and there is less opportunity for the speakers to interact, because he gets a very short time to deliver his topic. So that is why there is less opportunity for speakers to interact. And the atmosphere is absolutely formal. So there is no informal that anybody can get up and ask a question in a symposium. It's a one-way thing. This is a disadvantage. Coming to the next type of teaching learning method is called as a panel discussion. So in a panel discussion, there is a moderator with a team who holds an orderly and a logical conversation on a topic. So a moderator with a team who holds an orderly and a logical conversation on a given topic. The advantages of panel discussion are, again, there is an informal atmosphere and it identifies and explores a problem. The disadvantages are that you need skilled moderators, which are very few. Very few people are very skilled at moderation. So that is why this is one of the disadvantages. Coming to the next thing, which we all know, is the seminar. Now, seminar is a big, in homeopathy, seminars are a real big business. And that is why everybody knows about seminars. In a seminar, the subject is delivered as an article or a report, and many of the concepts are analyzed and discussed through the group discussions. So this is what happens usually in seminars. The advantages are that an authoritative guidance by an expert. So there is a person who is an authoritative guidance. Many people love to teach in seminars, but they don't like to teach in the classroom, because in the classroom it is very boring. You have to teach the same topic again and again, whereas and the students can question you there. In a seminar, usually you cannot question. So people say that I cure everything from common cold to HIV. Everything people are curing, presenting their cases in seminar. There is nobody to find out how much truth is there in these matters. So he's supposed to be an expert, the one who speaks at the seminar. Then there is an in-depth discussion over there. The atmosphere is absolutely informal. People just They sit in the first part of the seminar and then they go out, roam around, and they come back in the end last part of the seminar. So it is very informal, and the learners are usually active participants in a seminar. The disadvantages obviously are difficult in getting a good resource person. Many people are available, many people know how to speak, but a real good resource person is a very rarity. It is not very cost effective. A lot of money goes in preparing for a seminar, so there is a lot of finance involved in that. It also requires interest and motivated participants. Often what happens is that whenever a seminar is held, the principal of the college is called over there as a guest, and he is felicitated, and because of that it is imperative for him to bring along with him 50 or 100 students to attend the seminar. So those students are actually not interested in attending the seminar, but they are indirectly forced to come for these seminars. Coming to the next thing is a tutorial. Now, tutorial is made compulsory according to the CBDC syllabus, also the competency-based curriculum, which is there for the BHMS as well as for the MD. So, what a tutorial is actually, it is a small group of 10 to 13 learners who are guided by a teacher to clear the doubts and to improve the understanding. So, whenever we are teaching a big class, you actually cannot interact with them. But when you are in a small group in a tutorial, you can pay more attention to each student, and that is why tutorials are a good method to teach the students. The advantages are, like I told you, an ideal student teacher ratio is there, student teacher ratio. There is active learning in this, and there is an opportunity for the teacher to correct mistakes, because the group of teaching students is very small. Then a disadvantage is that the prior preparation by the student is needed. Many times students don't prepare and comes, which makes the tutorial absolutely ineffective. Coming to the next method, which is group discussion. I'm going a little faster because we have already lost 15 minutes. So this is coming to the next is group discussion. A group discussion is a face-to-face interaction between members of relatively small groups with a group leader over there. And so that is why a group discussion is there, which is usually called as a GD. So whenever you go for an interview and something, once you finish your theory exams, then you are put into a GD, which is a group discussion. One leader is made in that group who guides the discussion. There are people who are observing how the group discussion is going on and how active each student is discussing in this group discussions. The advantages are that obviously it is very democratic, so you can speak what you want, and you can take the lead if you feel like. If you're a good leader, you'll take the lead in the discussion. Then the learner's preparedness and active participation is needed. So the teacher doesn't know anything. Teacher is just an observer. So it is the students who actually need to prepare and to participate in this. And there is a synthesis of all the teaching learning methods, lectures, bedside teaching, everything is done in this group discussions. Disadvantages are, again, the student ratio, teacher ratio is maintained, and some may find it too slow, some may find it too fast. As we know that students are of different qualities, but when they sit in one group discussion, these differences are highlighted. So that is why some people may be very slow and the other people may be very fast. Coming to the next method of teaching, which is called as problem-based learning. So PBL is it is a learning emanating from a clinical-based problem. It uses a clinical problem to simulate discussion and identify learning issues by a small group. So usually in PBLs, a problem is given to the class, to a small group, and this group discusses this clinical problem in all its aspects. Suppose you give them you give them tuberculosis, so they discuss everything, right from the etiology, right from the clinical features, the differential diagnosis, right up to the treatment. Everything will be discussed. So you tell them, they prepare, the students will prepare and come. This is called as a problem based learning. It uses a clinical problem to simulate discussion and identify learning issues by a small group. The advantages are, obviously it encourages self learning, because if you don't read and come, you cannot solve the problem which is there in front of you. and it helps the student to fill in the gaps in the knowledge. Because when a teacher is taking a lecture in the class, the teacher cannot tell everything about a particular subject. So what it gives is bits and pieces to the students, and these remaining gaps which are there, the student reads on his own and fills in the gaps. That's how his knowledge becomes more concrete. So the development of skills are like literature search is encouraged. So literature search is very important. We all know that research is not possible unless you are able to, know how to do a literature search, to find out how much research has been done on this topic. And then and there only you can take the research forward from what knowledge is existing to what you want it to become. Then you have the development of social skills are also developed through the PBLs. Then the disadvantages of tutorials, I forgot this one point, which is very, very time consuming. Then coming to our next topic, which is called as the teaching learning media. Our objective of learning this teaching learning media is, number one, to know all the audio visual aids. For example, now we are on this, we are already on air, and we are through the internet, we are all connected to each other, and you are able to see my screen, and there is a computer, there's a laptop in front of me, there may be mobiles in front of you. So all these things account for what are audio visual aids. So they are helping us to learn. So that is why these audiovisual aids are a very effective method of teaching and learning. Then, to know the demerits and merits of each. Now, each of these audiovisual aids, for example, you have a LCD projector, you have a smart board, you have different types of audio and visual methods. So we should know the merits and demerits of these, because it will help us to use the merits of them in different settings. We should know which audiovisual aid needs to be used. To know the do's and don'ts while using them. What are the points which we should do? What are the points we should not do? For example, how a PPT is actually prepared. What should be a content of a good PowerPoint presentation? It should not have all matter. It should have only the highlights of the matter. The other remaining matter, the teacher is supposed to talk, impromptu, is supposed to talk about that topic. So it's not necessary that all the matter should be there on your slide. So to select an appropriate teaching aid is one of the objectives, and to express enthusiasm about making efforts for the preparation process of an audiovisual method. What is the need of a teaching learning media? Number one, it bridges, it builds bridges between students' knowledge and learning uh, students knowledge and learning objectives, and it engages the students always. So teaching learning media, it engages the students. Also, it aids the student in the retention of knowledge. Whenever you hear, and along with that hear, you are able to see also, and that may puts the things into your long term memory. So that is the importance of teaching learning media. It also aids the student in retention of knowledge. What we see and what we hear, if both things are combined together, this particular image which is there in front of our eyes, this knowledge gets into our long term memory. And that is what a doctor actually needs. A doctor cannot open his books always in front of the patients, so he needs to have all this knowledge in his long term memory, and that is one of the advantages of teaching through audiovisual aids. So that is why audiovisual method is a very effective method of teaching the students. Also, because of the audio, the monotony is broken, and that is why the students are very interested in the lecture, and it motivates them to take more interest and develop this to develop this skill which the teacher is trying to give them. So this is one of the things. Then what is the importance of a media in teaching and learning? The use of educational media is essential for the teaching and the learning process. That there is no two doubts about that. So educational media is very important. Then media can be utilized in almost every discipline to enhance the teaching in the class and out of the class. So teaching not necessarily means in the classroom. It can also be taught outside the classroom in the practical laboratory or in the tutorial rooms. So educational media can be taught used there also. Then research also suggests that the people learn abstracts, new and novel concepts more easily when they are presented both in the verbal and the visual form. And that is why they are called as audio visual aids. They are aiding the teaching and learning. And also the research says that if you are able to show them, and if you are able to tell them, show and tell together will have more impact on their minds than actually just talking or just in one lecture, because lectures usually after some time become very monotonous, and we all remember, and we all must be having experiences, and we all must be knowing about remembering our old teachers, some of whose lectures we were wide awake, and in some lectures we actually used to go off to doze off and then come back to the classroom at the end of the lecture. So that is how lectures are. So there are different types of teaching learning media. Number one is five types. So the first one is the verbal method. Second is the audio method, making them hear. For example, in the earlier times, you used to have these cassettes. So these cassettes used to tell you all about the heart sounds. So if you hear them, they used to tell you about what is a mid diastolic murmur, what is a machinery murmur, what is a continuous murmur. So all these things we used to hear on audio cassettes in the earlier times. Now the world has progressed, and you have all these audiovisual methods in front of you, and that is why these cassettes have now become obsolete. So verbal is what the teacher is teaching you. Audio is what audio tape he makes you hear. Then the next is the visual. The method of visual is like nowadays all classrooms mostly have a you have a smart board. On that smart board he puts his PowerPoint and he shows actually maybe a small film also, or maybe some slides. So this is the visual presentation of the material which is going to be which the student needs to know about. Then patient is also a teaching learning method. So like we observe the patients in homeopathy especially, we know that lot can be learned or lot can be diagnosed about the patient by observing him. So patients also become a type of a teaching learning media. And then you have the real objects and the models. So real objects, like for example we are using in for the spotting in the classroom, they are the objects. And you have different models through which also become a part of the teaching learning media. So the audiovisual aids we can divide into two. One is the non-projected visual aids, and the second is the projected visual aids. So coming to the non-projected visual aids, you have like the traditional method, which is the chalkboard method, or right now you have the whiteboard, a marker, and you have a whiteboard and you have a marker which you can use instead of a chalkboard. Then you can have flannel graphs, like on the side part, we used to have a flannel board on which different graphs were put up. So this can again be a method of visual, but this is not projected. So that is why they are called non-projected visual aids. Then you have different types of posters, like in colleges, you have charts on the walls. So all the walls of most of the colleges are full with charts, and these charts are in the department of the college, and the teacher doesn't want to look at them. The students never enter in the department because of the fear of the teacher. So I really wonder why these charts are made compulsory to be kept in the college. And once upon a time people used to think that it is a good method to teach and a good method to learn, but the charts were fixed by screws on all the walls, and that is why it was not possible for the teacher to remove that and take it to the classroom. In my college, in DY Patil College, we have all these charts are just pasted with a small two-way sticker on a whiteboard, and whenever the teacher needs, he can remove the chart and you can use it actually as a visual aid in the classroom. And that should be the purpose, and that should be the method by how charts are pasted in the colleges, rather than fixing them by screws on right at the ceiling level. They are usually pasted, and only inspectors used to come in the college and they used to count the charts. कि भाई how many 60 charts है कि 65 chart है, तो last time कितना chart था, तो last time you had 50, so this time you have 60. Okay, so development is there. So these charts used to be a method to judge the development of a college actually. Then you have different posters. Then you can have diagrams, you can have photographs, you can have different charts like I've just discussed with you. different specimens, and different models. So these were all the non-projected visual aids, which now usually have become a thing of the past. And the time has changed, and we have come to projected visual aids, which once upon a time we used to have the overhead projector, which has again become obsolete with the coming in of the smart board in the classroom. Then used to have the slide projector. Slides also have become obsolete because now everything is available at the press of a button. Then film strips used to be there. There used to be something called as a epidiascope, which is again obsolete. Then the micro projectors and the silent cine films. All these were different types of projected visual aids. We are nearly coming to an end of our presentation actually. So what are the advantages of using this teaching media? So the teaching media engages the students and helps to keep their attention focused on the lesson rather than getting bored and going off into a different world and coming back in the end of the class. Teaching media, good audiovisual media keeps the student attention focused. It also helps the students to stay engaged and interested in learning, and it also aids the student in the retention of the knowledge because it allows the students to read, to watch, and to hear information multiple times in different contexts. So you see, these are some of the advantages of using teaching learning media. I'm sure that all of us, when we were students, and we have attended many lectures, and the students of today are taught in some different modern methodology. I don't know whether the old teaching was good or the new teaching is good, but with the changing times, there used to be a time when people used to say that the mobile is there in the classroom and mobile should not be used and students should switch off the mobile. But I'm sure the times have changed now, and mobile is a very effective way of of teaching students because everything is available on the mobile for them. So many times in the classroom, if I want the students to find something, I know that if they go home they are going to Google. So in the classroom, I tell them many times that why don't you Google and find out this answer and tell me what is the answer is. So in the process of Googling, he learns 10 new things also. So that is again an effective way of teaching learning. I think we have 5 minutes remaining. I think this was my last slide. So thank you very much for a patient hearing. Thank you.
Yes,
I'll stop the sharing over here so we can take some questions if there are.
yes, yes, really a very good session indeed, sir. You showed how relevant all these things are because people are simply saying that, oh, it's a seminar, it's a class lecturing like that. What is the basic difference between all those things were beautifully discussed, and why a seminar is important, why a symposium is important, why a lecturing is important, and what are the things you want gain out of it, and how you can make the students more better uh, doctors in the future also. Not only doctors, whatever be the profession, they how it can be enhanced by utilizing all these things in this session. Excellent session, and congrats, sir. I invite Dr. Manoj to say a few things because Dr. Manoj was an he now he's chief medical officer, but later in the past he was he was working at the Department of Organon, Chandra Krishna Homeopathic Medical College.
Thank you, Dr. Sanesh. Dr. Dharmendra Sharma sir, it's a wonderful presentation, and I think this is a topic where the homeopathy lacks. Not only homeopathy, almost all systems. Why I am telling is that in a book by Dr. Kanji Lal, you can see that there is a reference. He said that this is a long consumer item where the consumer is not at all aware what they are getting. In each and every system, other things, other substances or commodities, the consumer is very much worried or bothered about the quality what they're getting. But in case of education, nobody is bothering what the student gains. And the problem in the professional, especially our medical education, is that if for you teach a student in nursery definitely he needs some sort of training. But what kind of training in pedagogy in case of this professional education system, the medical system? That's the most important thing. Then another thing is that the tone of the presenter is an important thing. Sound modulation is an important part. So what happens is that even though the quality is much higher, the teachers often talking in a monotonous way. It brings some sort of sleepiness to the student. That's often happening. Then another thing is that the vocabulary, especially in homeopathy, I think a minimum up to 10% of a Shakespeare in English is needed. I think minimum. That much wordings are there. That is not needed in allopathy or other engineering system. But for studying our material medical or of medicine, we need a lot of words in order to express different symptoms. Then another thing is that the pedagogy, the Aristotelian pedagogy as well as Socrates pedagogy, that's also very important. Our teachers should have an insight on that. How they are talking, they are communicating to students. It's an important thing. But these things are never considered, I think. Anyway, your presentation is wonderful one, but you must take this just a symposium, a series of talks, I think. This is a very zipped file that is not because we are not at all conscious about these things. You are really enjoying that. But our side, we are now they're wondering what it is. You said different types of lectures, symposiums, seminars, then the tutorials, then group discussions. Then again, with the arrival of the artificial intelligence, again, it changes. Then you said about the presentation of these models, but now the reality, virtual reality, the augmented reality is there. So everything is turned upside down, and moreover, the student should have an intelligent brain, should have an integrated minds. We should at least start some learning disability disorder to assess in the start of DHMS course, I think. Anyway, congratulations for your nice presentation. Thank you.
Thank you very much, sir. Thank you.
If anyone want to have a question or anyone want to speak to Dr. Dharmendra Sharma sir, you can raise your hand so that we will allow you to unmute and talk to sir. Anyway, Dr. Manoj has mentioned a lot of good things about the education system. We need to improve all those things in those areas where we are not, people are not looking at.
So now,
Frankly,
just to inform everybody that recently the MBBS course has come out with a new notification which says that student can now learn in mother tongue. So soon you will have MBBS in Kannada, and you will have MBBS in Telugu, and you will have MBBS in Hindi and Marathi. So this notification is soon coming to homeopathy colleges also. So in homeopathy colleges, student can write the paper not necessarily in English. He can write in his own mother tongue. He can write. Who will assess the paper is a different question. But this new notification is coming from this government now.
Yes, sir. Definitely, the material is the most important section there. That will advantage definitely with that discussion if it is.
Yes, yes, yes.
In Kent philosophy, Dr. Kent has mentioned about the relevance of the mother tongue. But the thing is that if we are going in that way, the communication between one-to-one from other part of the world as
It
well
will
as
be
other
very difficult. It is going to
very
become.
difficult because people, we know that in the early days, people from the north coming over Kerala and making big seminars, and people are wondering, oh, this doctor is a wonderful person, was making so much. But there are very good cures with our doctors also. But unfortunately, no one was recording all this again, uploading in the seminars. But these North Indian doctors really show the beauty of seminars in Kerala, and now the Kerala doctors has even become more international than the national.
Yes, yes, yes,
That is the beauty of the knowledge of language.
In fact, Ken mentioned that if you are English, then use English. There is a reference in the Kens like philosophy, I think.
Yes.
So the mother tongue is most important in teaching and learning. Moreover, the approach of the teacher should have an open-hearted fellow. That will more advantage, I think.
We have seen some teachers coming over, coming out to the classroom and simply reading material, and we were not able to differentiate what is the basic difference in the medicine taught yesterday and today. Because they don't know what are the things to be noted by more important than the total reading of the book. But that is the big thing. That is why Dr. Manoj mentioned about the tone of the presentation, the power of presentation. All those things is very, very relevant and very, very important to make a good teacher. To make one a good teacher. That's why in every college, 1 or 3 or 3 to 4 doctors are teachers are more respected than the others. That's what we have also seen also in our colleges. All others are just like coming over and doing something, and they are taking their money and going back. But some are not like that. Some are intimate. They are mingling with students. They are giving everything to the student, and then not only the knowledge but also giving all kind of support what they need to become a good doctor. Anyway, it's a very, very fine presentation. And so it's the time to wind up the session. I invite Dr. Manoj to say what are thanks to the session also.
Thank you, Dr. Sanesh. As I mentioned, this is a majestic session, I think. But unfortunately, we only have 30 plus participants. That is a indicator. Our people are not at all bothering about all these things. They are just going to the clinic and making some prescription, collecting some money, and going. But that is not at all new. That is what is desperately needed is we need some innovative things. As you just mentioned, more studying is needed, more education is needed. Unfortunately, what happens is now that only the post-graduation course is there. PhD is not at all there in majority of institutions. Moreover, we don't have the super specialty courses. Then we should have the specializations there. So in order to become competent in the present world. Moreover, the teachers, they don't have enough passion. As Dr. Tanesh mentioned, just they're doing their duty, don't have the passion. But we have to surpass all these things. If we have people like you, and you are capable of making these messages to our teachers, to the deaf ears, and the ossified brain circus, according to our store clause, these should reach. Anyway, on behalf of IFPH, and expressing sincere thanks to Dr. Dharmendra Sharma, and also inviting you to continue the participation in this session. Thank you, sir.
Thank you, sir. Thank you very much.
Yes,
Thank you, Danesh, sir. Thank you.
Yes. Yes, tomorrow we will have a session from Dr. Vibhu Prasad Pandey. He is also a professor and the principal hospital superintendent Institute of Homeopathy Research, Pearl Institute of Research, Vadodara, Gujarat. With that, we come to the end of the day, 1471. Thank you all. Good night. It's over to Dr. Mariamma John to moderate the Malayalam session.